You are the nurse assessing a 16-year-old girl who is the star of her high school's gymnastics team who is admitted to the hospital for fatigue and weakness. You examine her and notice that she appears hypovolemic, her hair appears thin and brittle, her parotid glands appear swollen, her knuckles have excoriations, and her teeth appear slightly yellow. You suspect that she most likely suffers from which of the following? A. Hypothyroidism. B. Exogenous testosterone administration. C. Bulimia nervosa. D. Anorexia nervosa. E. Marfan syndrome. The answer is C. Bulimia nervosa. Bulimia nervosa is an eating disorder in which a patient classically consumes large amounts of food, binge eating, and then induces vomiting, purge behavior, to expel the food prior to absorption in the gastrointestinal tract. As such, the patient restricts their ability to gain weight. Patients with bulimia nervosa are frequently successful, high-achieving individuals under a great deal of stress, and often may be adolescent athletes, as patients in this population frequently have specific weight cutoffs that they must achieve for their respective sports, activities. Some signs of bulimia nervosa, as exhibited by this patient, are thin, brittle hair, a hypovolemic appearance, due to frequent vomiting, excoriations on the knuckles, from self-inducing vomiting with their hands, yellow discoloration of the teeth, from the acidity of vomitus, and swelling of the parotid glands, colloquially known as chipmunk cheeks, as a response to the frequent vomiting. Patients with bulimia may also use other methods to purge themselves of food and drinks including diuretic use, and/or laxative use. A key distinction between bulimia nervosa and anorexia nervosa is that in bulimia the patient exhibits a form of purge behavior following binge eating, whereas in anorexia, classically, the patient simply restricts eating rather than binging and purging. Hypothyroidism is not a correct answer choice because while this patient is exhibiting lethargy, weakness, and brittle hair, given the constellation of her other symptoms and exam findings, it is less consistent with her presentation than bulimia nervosa. If these symptoms persisted following treatment for bulimia, then hypothyroidism could be considered as a concurrent finding. Exogenous use of testosterone would not account for the symptoms seen in this patient. Marfan's syndrome would also not account for the symptoms seen in this patient. Patients with Alzheimer's dementia develop degeneration in which of the following memory processing centers of the brain? A. Prefrontal cortex. B. Occipital lobe. C. Hippocampus. D. Amygdala. E. Wernicke's area. The answer is C. Hippocampus. The hippocampus is implicated in memory formation and processing. As individuals age, the development of plaques in this area of the brain lead to the pathogenesis of Alzheimer's dementia. The amygdala is the brain structure associated with fear. Wernicke's area is for language formation. The occipital lobe deals with vision. The prefrontal cortex is involved with primitive behavior and impulses. A 34-year-old man presents with severe lower back pain, a feeling of numbness around his buttocks and inner thigh, erectile dysfunction, and incontinence. Which of the following conditions is likely to be causing his symptoms? A. Parkinson's disease. B. Multiple sclerosis. C. Prostatitis. D. Cauda equina syndrome. The answer is D. Cauda equina syndrome. While any of this patient's symptoms may be present in multiple sclerosis, this specific set of symptoms is typical of cauda equina syndrome. This is a condition in which trauma or impingement within of the spinal canal compresses the cauda equina, the bundle of spinal nerves and nerve roots near the base of the spinal cord. Neither prostatitis or Parkinson's disease generally present with this distinct triad of back pain, saddle anesthesia, and sexual and/or urinary dysfunction. Which of the following tests can help identify if an individual is actively having a seizure? A. Computerized axial tomography, CAT, scan. B. Magnetic resonance imaging, MRI, of brain. C. Electrocardiogram, EKG. D. Electroencephalogram, EEG. E. Pulmonary function test, PFT. The answer is D. Electroencephalogram, EEG. A seizure is an abnormal electrical event in the brain, usually caused by diffuse, rapid firing of neurons within the brain. An EEG is the diagnostic test used to capture events and identify where in the brain the impulse is generated from. EEG consists of electrodes placed on the scalp. The other tests mentioned cannot identify the electrical activity of the brain. A 62-year-old homeless male presents to the emergency department appearing agitated, confused, and panicked. You note that he is sweating profusely, and when you take his vitals, he is hypertensive and tachycardic. He says that he takes a pill from the street every day that calms him down, but that he has not taken it for 24 hours. Which of the following is the most likely diagnosis? A. Heroin intoxication. B. Benzodiazepine withdrawal. C. Ketamine intoxication. D. Cocaine withdrawal. E. Benzodiazepine intoxication. The answer is B. Benzodiazepine withdrawal. The correct answer is benzodiazepine withdrawal because the patient's presentation, with agitation, confusion, and panic, coupled with his physical and vital sign findings, tachycardia, hypertension, profuse sweating, and historical information, has not taken a regular medication of his for 24 hours, are all consistent with benzodiazepine withdrawal. Benzodiazepines are a class of medications that have anxiolytic and anticonvulsant properties, as they increase the efficacy of the neurotransmitter GABA. Given their anxiolytic properties, and in some types, their rapid speed of onset, they are a commonly abused class of drugs. Benzodiazepine withdrawal occurs when a patient who regularly takes benzodiazepine medications and has a physiological dependence abruptly stops taking these medications. Symptoms of benzodiazepine withdrawal include but are not limited to anxiety, panic, agitation, hypertension, tachycardia, diaphoresis, and inability to sleep. If untreated, this can lead to seizures and worsening confusion. As such, it is important to recognize these symptoms early and restart benzodiazepine treatment as early as possible in these patients. Benzodiazepine intoxication, cocaine withdrawal, and heroin intoxication are incorrect as the patient would exhibit symptoms opposite those described in this example. Ketamine intoxication is incorrect, as ketamine is a dissociative medication that would not likely cause this constellation of symptoms, and would be more likely to present with dissociative properties. You are the nurse in a psychiatrist's office taking care of a patient who presents with 3 years of pulling at her hair in a compulsive manner. The patient states that she has a strong urge to pull her hair out, especially in times of stress, and that removing hairs helps to relieve tension. She is bald on 2/3 of her scalp, and feels very distressed and socially impaired. Which of the following best describes this patient's illness? A. Agoraphobia. B. Walking corpse syndrome. C. Social phobia. D. Trichotillomania. E. Arachnophobia. The answer is D. Trichotillomania. Trichotillomania describes the obsessive-compulsive condition in which patients have an uncontrollable urge to remove their hair, which causes baldness, and social, emotional distress and impairment. Patients typically pull hair from the scalp, eyebrows, lashes, and extremities. Treatment includes a variable combination of psychotherapy and/or medications. On the other hand, the other choices are incorrect. Walking corpse syndrome is a psychiatric condition in which a patient thinks that they are dead, while in reality, they are indeed alive. Arachnophobia is a fear of spiders. Agoraphobia is a fear of being in public places. Last, social phobia is a fear of social situations. A patient with a past medical history of hypertension comes into the emergency room reporting the sudden onset of the worst headache of their life. They feel nauseous with blurry vision and generally appear unwell. What is the most likely diagnosis based on this history? A. Subdural hematoma. B. Epidural hematoma. C. Subarachnoid hemorrhage. D. Herpes simplex virus. The answer is C. Subarachnoid hemorrhage. The worst headache of my life or thunderclap headache is characteristic of subarachnoid hemorrhage. This is bleeding in the brain and must be treated urgently. It is usually caused by the rupture of a barrier within the blood supply to the brain. Hypertension is a major risk factor. A 50-year-old female client recently diagnosed with multiple sclerosis, presents to the clinic after having a history of several neurological symptoms and is asking the nurse about her condition. The nurse is glad to teach the client about multiple sclerosis. Which of the following statements about multiple sclerosis is correct? A. Multiple sclerosis is a disease of the dopamine-producing neurons of the substantia nigra of the midbrain, causing overall weakness. B. Multiple sclerosis is a genetically transmitted disease which affects the basal ganglia and the extrapyramidal system with a deficiency of acetylcholine. The effects are seen in both physical and cognitive dysfunction. C. Multiple sclerosis is a progressive and chronic degenerative disorder. The condition leads to demyelination of the nerve fibers of the central nervous system, causing various neurological defects. D. Multiple sclerosis is a disease where excess release of dopamine and increased serotonin levels lead to neurological dysfunction. E. Multiple sclerosis is an autoimmune disease of the neuromuscular junction characterized by variable weakness of different muscle groups. The answer is C. Multiple sclerosis is a progressive and chronic degenerative disorder. The condition leads to demyelination of the nerve fibers of the central nervous system, causing various neurological defects. Multiple sclerosis is an autoimmune process with no exact known cause. The myelin sheath is attacked and plaque formation occurs in various regions of the CNS. Without myelin, nerve conduction slows down and may eventually be completely blocked, leading to widespread loss of function. Loss of the dopamine-producing neurons describes Parkinson's disease. Excess dopamine describes dementia. Deficiency of acetylcholine describes Huntington's disease, and the autoimmune disease of the neuromuscular junction is known as myasthenia gravis. Bell's palsy is due to dysfunction of which of the following cranial nerves? A. Cranial nerve 8. B. Cranial nerve 7. C. Cranial nerve 3. D. Cranial nerve 4. The answer is B. Cranial nerve 7. Bell's palsy is due to dysfunction of cranial nerve 7, the facial nerve. The facial nerve provides motor control to the musculature of the face and sensory innervation of taste, facial sensation, and parasympathetic innervation of the submandibular and sublingual glands. Which of the following classes of medication is not used for treatment of migraine headaches? A. Antidepressants. B. Triptans. C. Beta blockers. D. All of these may be used to treat migraines. The answer is D. All of these may be used to treat migraines. Migraine headaches are commonly treated at first by over-the-counter, OTC, medications such as NSAIDs and acetaminophen. Other treatment options include triptans, antidepressants such as amitriptyline, and antihypertensives, beta blockers and calcium channel blockers. You are caring for a patient who is started on clindamycin, ketorolac, prednisone, lisinopril, and simvastatin. After receiving multiple doses of each of these medications, you notice that the patient's blood glucose is 205 mg per deciliter. Which of these medications is known to cause hyperglycemia? A. Ketorolac. B. Lisinopril. C. Simvastatin. D. Prednisone. E. Clindamycin. The answer is D. Prednisone. Of all the medications listed, prednisone is the only medication that is known to cause hyperglycemia. Prednisone has a number of side effects including hyperglycemia, acne, headache, restlessness, insomnia, nausea, vomiting, and weight gain, among others. Clindamycin's side effects include diarrhea, including Clostridium difficile, and less commonly nausea, vomiting, and abdominal pain, among others, but not hyperglycemia. Ketorolac's side effects include renal toxicity, tinnitus, heartburn, diarrhea, and abdominal pain, among others, but not hyperglycemia. Lisinopril's side effects include hypotension, lightheadedness, angioedema, and barky cough, among others, but not hyperglycemia. Simvastatin's side effects include muscle pains, aches, muscle weakness, and less frequently confusion, and electrolyte disturbances, but not hyperglycemia. Which of the following interventions has been shown to be effective in reducing the severity of pain in cluster headaches? A. Heel drop maneuver. B. 100% oxygen at minimum 12 liters per minute. C. Hot and cold alternating applications. D. Carotid sinus massage. The answer is B. 100% oxygen at minimum 12 liters per minute. One non-pharmaceutical intervention that has shown to provide relief for a significant number of individuals with cluster headaches is 100% oxygen, delivered via mask at a minimum of 12 liters per minute. Relief can be felt in as little as 15 minutes. None of the other interventions mentioned would be likely to improve symptoms of a cluster headache. Bell's palsy is associated with infection by which of the following pathogens? A. Epstein-Barr virus. B. Herpes simplex 1. C. Herpes zoster. D. All of these are correct. The answer is D. All of these are correct. While Bell's palsy is most frequently associated with prior infection with herpes simplex 1, it may also be associated with cytomegalovirus, Epstein-Barr virus, and herpes zoster. What is the prognosis with Bell's palsy? A. Antiviral treatment is required to prevent permanent paralysis. B. Nerve resection is required to prevent corneal abrasions. C. Corticosteroid treatment is required to prevent permanent loss of taste. D. Self-resolving in 1 to 6 months. The answer is D. Self-resolving in 1 to 6 months. In the vast majority of cases, Bell's palsy resolves within 1 to 6 months without medical intervention. Moistening of the affected eye, rather than nerve resection, is required during this period to prevent corneal damage. There is very little risk of permanent paralysis or loss of taste. All of the following are common etiologies of seizure disorders except dash. A. Marijuana use. B. Genetic predisposition. C. Infection. D. Brain tumor. The answer is A. Marijuana use. The most common causes of seizures include brain injury or tumor, genetic predisposition, medications, and infections such as meningitis. While marijuana may be a trigger for sensitive individuals with seizure disorders, it has not been known to cause seizures in a non-epileptic individual and has shown to reduce seizure incidence in some individuals with this condition when used in a medical setting. All of the following medications are considered first-line treatments of absence seizures except dash. A. Valproic acid. B. Ethosuximide. C. Lamotrigine. D. Carbamazepine. The answer is D. Carbamazepine. The most commonly prescribed medication for absence seizures is ethosuximide. Lamotrigine and valproic acid may also be used if seizures are unable to be controlled with ethosuximide. Carbamazepine, a common medication prescribed for simple and complex partial seizures, is specifically contraindicated in absence seizures. A patient is hospitalized for alcohol withdrawal and is started on medication to prevent complications from withdrawal. Which type of medication is used to attenuate the possibility of seizures during this hospitalization? A. Benzodiazepines. B. Typical antipsychotic. C. Atypical antipsychotic. D. Selective serotonin reuptake inhibitor, SSRI. E. Anti-epileptic drug, AED. The answer is A. Benzodiazepines. Benzodiazepines are the mainstay of treatment for alcohol withdrawal. Anti-epileptic drug, AEDs, are not to be used during alcohol withdrawal, and are reserved for patients who have a true seizure disorder. The Clinical Institute Withdrawal Assessment for Alcohol, CIWA, protocol is used as symptom-based therapy with benzodiazepines to prevent seizures and other complications from withdrawal. Which of the following is the first-line treatment for cauda equina syndrome? A. Surgical decompression. B. Physiotherapy. C. Chiropractic manipulation. D. Muscle relaxants. The answer is A. Surgical decompression. Cauda equina syndrome is a serious condition in which the cauda equina is disturbed within the spinal cord, generally due to impingement, trauma, local lesion, or compression. The first-line treatment is surgical decompression. Neither physiotherapy nor muscle relaxants would address the cause of this condition, and chiropractic manipulation may actually exacerbate the symptoms. A client admitted to the neurointensive care unit is having his level of responsiveness assessed by the nurse on duty. Her findings include eyes opening to verbal command, is disoriented but can converse, and obeys commands. What is this client's Glasgow Coma Scale score? A. 12. B. 16. C. 8. D. 13. E. 15. The answer is D. 13. The score of this client includes, eye-open response is a 3 out of 4, best verbal response is 4 out of 5 and best motor response is 6 out of 6. An unconscious patient exhibits stiffly extended arms that are also adducted with the wrists hyperpronated. The nurse recognizes this presentation to be dash. A. Vertebrate positioning. B. Vestibulospinal reflex. C. Crossed extensor reflex. D. Decorticate positioning. E. Babinski reflex. The answer is A. Vertebrate positioning. Vertebrate positioning is an involuntary response of abduction, extension, and hyperpronation of the upper extremities due to noxious stimuli. There also is hyperextension of the lower extremities and the feet are plantar flexed. Decorticate positioning involves mommy-baby posture, elbows, wrists, and fingers flexed, and legs extended and rotated medially. The Babinski reflex involves the extension of the big toe following stimulation of the sole of the foot. The crossed extensor reflex is also known as the withdrawal reflex, which involves the differential flexion and relaxation of muscles in the withdrawal of a limb. Vestibulospinal reflexes involve the use of vestibular organs and skeletal muscle to maintain balance, posture, and coordination. Swaying or inability to maintain balance while standing with the eyes closed is considered a positive finding in what test? A. Romberg's test. B. Test for ataxia. C. Gait test. D. Rapidly alternating movement test. The answer is A. Romberg's test. Romberg's test is an evaluation of both proprioception and vestibular function. The patient is asked to stand with eyes open, then to close their eyes and remain still. Any tilting or loss of balance is considered to be a sign of either proprioceptive or vestibular impairment, and should be evaluated further. Gait test assesses for gait abnormalities. Rapidly alternating movement test is done with the patient seated with their hands on their thighs. They are asked to rapidly turn their hands over, then return them palms down to their thighs 10 times. This test is evaluating for dysdiadochokinesis, or inability to perform rapidly alternating movements. Ataxia, or the loss of control of bodily movements, is not a specific test, but rather a clinical finding. A 46-year-old patient presents with dysdiadochokinesis, an inability to perform rapidly alternating movements. What condition is the most common cause of dysdiadochokinesis in adults? A. Lesion in the pons. B. Multiple sclerosis. C. Parkinson's disease. D. Cerebellar lesion. The answer is B. Multiple sclerosis. In adults, the most common cause of dysdiadochokinesia is multiple sclerosis. Cerebellar lesion is the most common cause of this finding in children. This symptom is not a normal finding in Parkinson's disease, or in pontine gliomas, tumors of the pons, though neurological impairment or ataxia itself may make rapidly alternating movements difficult. A 26-year-old woman presents to urgent care after a bike accident in which she got a bad bump on the head. She was not wearing a helmet. She must now be assessed for increased intracranial pressure. All of the following are signs of increased intracranial pressure except dash. A. Effort-related or positional headache. B. Altered consciousness. C. Migraine aura that persists after headache has resolved. D. One or both pupils are dilated and unresponsive to light. The answer is C. Migraine aura that persists after headache has resolved. Increased intracranial pressure can be chronic or acute. The nurse must assess for pupillary response, level of consciousness, and quality of headache if present, in addition to motor response. Migraine aura that persists after headache has resolved should be evaluated for stroke, transient ischemic attack, or arteriovenous malformation. Which of the following terms denotes neurological impairment of the ability to speak or understand language? A. Apraxia. B. Ataxia. C. Dysmetria. D. Aphasia. The answer is D. Aphasia. Aphasia is the term for neurological impairment of a person's ability to speak or understand language. The other terms listed all denote various deficiencies. Ataxia is a loss or lack of coordinated motor function. Apraxia describes the lack of motor planning or inability to execute a specific intentional movement. Dysmetria is an inability to judge distance when attempting movements such as grasping at a nearby object. The nurse cares for a patient who is prescribed phenytoin for seizures. Which of the following serum drug levels would most concern the nurse? A. 10 microgram per milliliter. B. 12 microgram per milliliter. C. 20 microgram per milliliter. D. 16 microgram per milliliter. E. 8 microgram per milliliter. The answer is E. 8 microgram per milliliter. The therapeutic serum phenytoin level is between 10 to 20 microgram per milliliter. 8 microgram per milliliter would be below the therapeutic level and may be due to noncompliance by the client or increased metabolism of the drug. The other options are within the listed therapeutic range. Which of the following is a term for an abnormal surge or excess of electrical activity in the brain? A. Dyskinesia. B. Twitch. C. Spasm. D. Seizure. The answer is D. Seizure. A seizure is defined as an abnormal surge or excess of electrical activity in the brain. This can result in partial or total loss of consciousness, and may cause muscular spasms, twitches, or other types of dyskinesia, disorders of movement. Spasms, twitches, and dyskinesias are not always caused by seizure disorders, however, they may be caused by a wide range of neuromuscular dysfunctions. Schizophrenic individuals frequently have abnormally high levels of what signaling molecule? A. Serotonin. B. Acetylcholine. C. Norepinephrine. D. Dopamine. The answer is D. Dopamine. While many people with schizophrenia do seem to have dysfunctions in multiple signaling molecules, excess levels of dopamine have been clearly associated with this disorder. Hank is a schizophrenic 46-year-old male. He experiences a persistent belief that a particular television commercial actor is addressing him directly, and that the commercial was created specifically to communicate with him. What type of delusion is Hank experiencing? A. Delusion of control. B. Erotomania. C. Delusion of reference. D. Kota or delusion. The answer is C. Delusion of reference. The belief that general or innocuous events exist specifically for or relate specifically to an individual is called a delusion of reference. Examples include belief that a billboard or television commercial is attempting to communicate directly to an individual, the ascribing of significance to random coincidences, or the observation of coded signals or signs in the general environment. Charlotte is a 19-year-old female with new onset of paranoia and auditory hallucinations. She has a positive family history for schizophrenia. Recently she admitted to her nurse that she can hear what other people are thinking. As she describes it, this does not come in the form of sound, but is communicated directly to her brain. Charlotte is likely experiencing which of the following? A. Thought broadcasting. B. Auditory hallucination. C. Telepathy. D. Delusions of persecution. The answer is A. Thought broadcasting. The belief that other people can hear one's thoughts is described by the term thought broadcasting. This is a common symptom in schizophrenia. It is differentiated from telepathy in that thought broadcasting, there is a delusion that thoughts can be heard by anyone, while telepathy is generally nonverbal communication between specific individuals, and may be receptive as well as projective. Auditory hallucinations are false perceptions of sounds, or internal thought perceived as emanating from another source, while delusions of persecution can take many forms but generally include a degree of paranoia or feeling of being targeted for harm or attack. The term positive symptoms in schizophrenia refers to which of the following? A. The loss of a specific sense, such as loss of sense of smell, anosmia. B. Any cognitive excess or distortions, such as delusions or hallucinations. C. Any symptom that increases confidence or leads to grandiosity. D. Repetitive physical movements or gestures. The answer is B. Any cognitive excess or distortions, such as delusions or hallucinations. Positive symptoms in schizophrenia are any symptoms of cognitive excess or disordered thinking. These include delusions, such as delusions of grandeur or persecution, hallucinations, and disorganized speech or behavior. Which of the following conditions can decrease sensitivity to sweet and bitter tastes? A. Rheumatoid arthritis. B. Psoriasis. C. Depression. D. ADHD. The answer is C. Depression. Depression has been linked with alterations in taste sensation, including decreased sensitivity to sweetness. This may contribute in some part to the high consumption of sweet foods and certain individuals experiencing a depressive episode. None of the other conditions listed have been correlated with alterations in taste receptor function. You are an emergency department nurse taking care of a 16-year-old female who complains of fatigue and syncope. You learn that she has only been drinking water for the last 2 weeks and has only been eating a piece of bread per day for the last 4 weeks, as she is worried that her classmates may make fun of her for being too fat during her upcoming dance. Her BMI is 14. Which of the following is the most likely diagnosis? A. Bulimia nervosa. B. Anorexia nervosa. C. Binge eating disorder. D. Major depressive disorder. E. Generalized anxiety disorder. The answer is B. Anorexia nervosa. In this patient, who is a young female, which is the most commonly encountered demographic for eating disorders, she notes that she has been drastically restricting her intake of food, that she has body dysmorphic thoughts, for example thinking that she is too fat despite that her BMI is 14, and we learn that her BMI is 14. A diagnosis of anorexia can be made if a patient is restricting their eating or drinking intentionally, and/or is participating in purge behavior, and has a BMI less than 17.5, as in this patient. While generalized anxiety disorder and/or major depressive disorder are often comorbid in patients with eating disorders, there is not enough evidence in the example to suggest either diagnosis for this patient. A syndrome of pain in the front of the knee, frequently occurring in teenagers, manual laborers, and athletes. It's sometimes caused by wearing down, roughening, or softening of the cartilage under the kneecap. What condition is described? A. Leg-Calf-Perthes syndrome. B. Osgood-Schlatter disease. C. Patellofemoral syndrome. D. Congenital scoliosis. The answer is C. Patellofemoral syndrome. Patellofemoral syndrome presents as pain in the front of the knee, sometimes caused by wearing down, roughening, or softening of the cartilage under the kneecap. Osgood-Schlatter disease is a syndrome of irritation of the patellar ligament at the tibial tuberosity, characterized by painful lumps just below the knee, most often seen in young adolescents. Leg-Calf-Perthes syndrome is due to disruption of blood flow to the femoral head, leading to a vascular necrosis. Congenital scoliosis is a spinal deformity characterized by the curving of the spine at an angle greater than 10 degrees on radiography. What condition is described by the following? A syndrome of irritation of the patellar ligament at the tibial tuberosity, characterized by painful lumps just below the knee, most often seen in young adolescents. A. Osteomalacia. B. Osteosarcoma. C. Osgood-Schlatter disease. D. Slipped capital femoral epiphysis. The answer is C. Osgood-Schlatter disease. Osgood-Schlatter syndrome of irritation of the patellar ligament at the tibial tuberosity, characterized by painful lumps just below the knee, most often seen in young adolescents. Risk factors may include overzealous exercise, but it's ultimately thought to be caused by adolescent bone growth. Osteosarcoma, the most common bone cancer in adolescent populations, can present with pain and a lump or frank swelling. This is caused by actual tumor growth, not by any ligamentous issue. Osteosarcoma does present frequently in the knee, and must be ruled out before a diagnosis of Osgood-Schlatter disease is made. Slipped capital femoral epiphysis causes pain and reduced movement in the hip, rather than the knee. Osteomalacia is a general softening of the bones caused by a deficiency in vitamin D. What condition will show a pencil in cup deformity on X-ray? A. Psoriatic arthritis. B. Juvenile rheumatoid arthritis. C. Rheumatoid arthritis. D. Osteoarthritis. The answer is A. Psoriatic arthritis. Psoriatic arthritis will often show a pencil in cup deformity on X-ray. Osteoarthritis will show joint space narrowing, sclerosis, and osteophytes. Rheumatoid arthritis and juvenile rheumatoid arthritis will both show soft tissue swelling, joint space narrowing, and may show marginal erosions. Rheumatoid arthritis typically presents with what type of deformity in the distal joints of the fingers? A. Shepherd's crook deformity. B. Heberd node. C. Swan neck deformity. D. Pencil in cup deformity. The answer is C. Swan neck deformity. Swan neck deformity is often seen in patients with rheumatoid arthritis. This is a state in which the distal interphalangeal joint, DIP, becomes hyperflexed, bends toward the palm, while the proximal interphalangeal joint, PIP, is hyperextended, bending away from the palm. Shepherd's crook deformity is seen in Paget's disease of the bone, pencil and cup deformity is seen in psoriatic arthritis, and T-burden nodes are frequently seen in the distal phalanges of patients with osteoarthritis. What is the most common form of muscular dystrophy? A. Emery Dreifuss. B. Duchenne. C. Becker. D. Myotonic. The answer is B. Duchenne. Duchenne's is the most common and most severe form of muscular dystrophy, accounting for a full 50% of cases of muscular dystrophy in the U.S. The next most common type is Becker's, followed by myotonic muscular dystrophy and Emery Dreifuss. Which of the following conditions is associated with autoantibodies to presynaptic calcium channels? A. Myasthenia gravis. B. Lambert-Eaton syndrome. C. Dermatomyositis. D. Multiple sclerosis. The answer is B. Lambert-Eaton syndrome. Lambert-Eaton syndrome is a condition of progressive muscle weakness caused by an autoantibodies to presynaptic calcium channels in the neuromuscular junction. This does not allow calcium to enter the presynaptic cell, which is required for neurotransmitter release into the synaptic cleft. Without the release of neurotransmitter, there will be no muscular response. Myasthenia gravis is an autoimmune condition in which antibodies are formed against acetylcholine receptors, and muscular weakness in multiple sclerosis is caused by destruction of myelin in the CNS due to antibodies against oligodendrocytes. Dermatomyositis is an inflammatory connective tissue condition that may be associated with a post-viral autoimmune reaction or triggered by a perineoplastic syndrome. What are the classic histological findings of dermatomyositis? A. Fibrous muscle fibers and fatty infiltrates. B. Parafascicular muscle fiber atrophy and fatty infiltrates. C. Granulomas and necrotic muscle fibers. D. Mixed B-cell and T-cell paravascular inflammatory infiltrate and parafascicular muscle fiber atrophy. The answer is D. Mixed B-cell and T-cell paravascular inflammatory infiltrate and parafascicular muscle fiber atrophy. Histological findings of dermatomyositis will generally reveal mixed B-cell and T-cell paravascular inflammatory infiltrate and parafascicular muscle fiber atrophy. Fibrous muscle fibers and fatty infiltrates are typical of Duchenne's muscular dystrophy, while granulomas in muscle are rare but may be seen in sarcoidosis and other conditions of granulomatous myositis. 90% of adult rhabdomomas are located in what area? A. The calf. B. The upper arm. C. The lower back. D. The neck. The answer is D. The neck. A rhabdomoma is a benign tumors of striated muscle. 90% of adult rhabdomomas present as round masses in the neck. What dermatological condition is often seen with dermatomyositis? A. Periorbital heliotrope rash. B. Perioral dermatitis. C. Dermatitis herpetiformis. D. Miller rash. The answer is A. Periorbital heliotrope rash. A periorbital heliotrope rash is often seen in dermatomyositis. It is bilateral, symmetric, purpuric, and macular, and erupts over the eyelids and surrounding periorbital area. Miller rash, often called a butterfly rash, is seen in patients with systemic lupus erythematosus, SLE. Dermatitis herpetiformis is a rash on the elbows and knees generally seen with gluten allergy, celiac disease. Perioral dermatitis is an iatrogenic condition often associated with prolonged use of topical steroid creams. What condition typically presents as symmetric proximal muscle weakness in the upper and lower extremities, often without the presence of distal muscle weakness? A. Dermatomyositis. B. Myasthenia gravis. C. Guillain-Barré syndrome. D. Polymyositis. The answer is D. Polymyositis. Polymyositis is characterized by symmetric proximal muscle weakness in the upper and lower extremities, often without the presence of distal muscle weakness. The first sign is often weakness in the thighs while walking, the inability to rise from a seated position without assistance, or the inability to raise the arms above the head. Dermatomyositis generally includes a characteristic periorbital rash. Weakness is expressed in the neck, arms, and legs. Guillain-Barré syndrome is an ascending paralysis. Symptoms start in the hands and feet, then spread proximally as it progresses. Muscular weakness in myasthenia gravis is often especially expressed in muscles of the face and head, especially those that control eye and eyelid movement, facial expression, chewing, swallowing, and speaking. What condition is characterized by high bone turnover due to accelerated osteoclast and osteoblast activity? A. Osteogenesis imperfecta. B. Giant cell tumor. C. Paget's disease of bone. D. Multiple myeloma. The answer is C. Paget's disease of bone. Paget's disease of bone is a condition characterized by high bone turnover due to accelerated osteoclast and osteoblast activity. This results in increased calcification of bones, especially prominent in the skull, pelvis, femur, and tibia. Osteogenesis imperfecta is an issue with collagen formation that causes fragile bones and multiple fractures. Multiple myeloma is a malignancy of plasma calls, and giant cell tumors are rare tumors that generally originate from the epiphysis of long bones, with no effect on bone deposition. At what age will Paget's disease of the bone generally first present? A. Over 70. B. Children ages 6 to 12. C. Early adolescence. D. Over 55. The answer is D. Over 55. Paget's disease of the bone generally presents in after the age of 55, and is very rare in younger individuals. The prevalence in individuals over 55 is as high as 3%. Which of the following is a benign, bone-forming tumor characterized by a small area of neoplastic growth surrounded by an area of mature, reactive bone? A. Osteoid osteoma. B. Ewing's sarcoma. C. Osteosarcoma. D. Fibrosarcoma. The answer is A. Osteoid osteoma. Osteoid osteoma is a benign, bone-forming tumor characterized by a small area of neoplastic growth surrounded by an area of mature, reactive bone. Fibrosarcoma, osteosarcoma, and Ewing's sarcoma are all malignancies. What is the most common primary malignancy of the bone, excluding hematopoietic malignancies? A. Osteoid osteoma. B. Fibrosarcoma. C. Ewing's sarcoma. D. Osteosarcoma. The answer is D. Osteosarcoma. Osteosarcoma is the most common primary malignancy of bone, excluding hematopoietic malignancies, making up approximately 20% of all primary bone cancers. Fibrosarcoma and Ewing's sarcoma are relatively rare conditions, and osteoid osteomas are as non-malignant. About 75% of osteosarcomas occur in what region? A. The upper arm. B. The distal femur or around the knee. C. The pelvis. D. The thoracic spine. The answer is B. The distal femur or around the knee. Roughly 75% of osteosarcomas occur in the distal femur or around the knee. The next most common site is the upper arm. Spinal or pelvic involvement are rare. The majority of osteosarcomas occur in what age group? A. Individuals over 65 years of age. B. Preteens and adolescents. C. Middle age. D. Children under 10. The answer is B. Preteens and adolescents. The majority of cases of osteosarcoma are in children and adolescents between the age of 10 and 25. It's the most common type of bone cancer in children and young adults, and the third most common cancer in teens. Which of the following is a neurological movement disorder typified by sustained muscle contractions causing abnormal posture, twisting, restricted movement, and pain? A. Geniospasm. B. Dystonia. C. Billismus. D. Torticollis. The answer is B. Dystonia. Dystonia is a condition of sustained muscle contractions causing abnormal posture, twisting, restricted movement, and pain. Torticollis is a form of dystonia specific to the muscles of the neck. Billismus is a condition of rapid, violent involuntary motions. Geniospasm is specific to the mentalis muscle, causing involuntary movements of the jaw. A 35-year-old male client presents to the emergency department after sustaining a severe tibial fracture to the left leg. The nurse is assessing the injury for possible complications including compartment syndrome. All of the following interventions would be appropriate to compartment syndrome except dash. A. Assess the bandage applied, loosen if necessary. B. Assess urine output for dark smoky urine. C. Elevate the injured limb and apply ice packs. D. Notify the physician if no peripheral pulses are detected. E. Assess for paresthesis, pallor, and pain in the left lower leg. The answer is C. Elevate the injured limb and apply ice packs. Elevation of the limb above the heart may slow arterial perfusion and raise venous pressure, and worsen circulation. Ice may cause vasoconstriction and further lead to circulation compromise. Both of these interventions would not be appropriate for compartment syndrome. Know the 6 P's of compartment syndrome: pallor, pain on passive movement, paresthesia, paralysis, pulses, pressure. All of these may be present in compartment syndrome. Pulselessness is an ominous sign of impending permanent damage. The physician should be notified. Muscle damage can lead to myoglobinemia of the blood, thereby damaging the kidneys, leading to abdomyolysis and dark urine. A tight bandage could further increase the pressure in the compartment and should be loosened if this is so.